Good evening. This is Dr. John Brimhall. I'm going to kick things off a little bit tonight, and our guest, Doug Grant, is going to come right behind me, and Clark Tilley is manning the wings here and helping us out. So let me give you a brief overview of who we are in case you're new to listening tonight, or to remind you if you've been around for a long time. I have been in practice now. This is my 47th and a half year. I am 71 years old, and I run around like a head with my chicken cut off, like I'm at least 30, maybe, but definitely not 70. And it comes from taking good nutrition and following what we call the 6 steps to wellness. If there's any claim to fame my son, Dr. Brett, and I have, it is that we developed the 6 steps, 6 interferences and 6 steps by seeing thousands of patients over this last 40 years and determining if some people had structural problems. You correct the spine or the cranium or the elbow, and they get better. Some people had emotional stress. If you didn't correct the emotional stress and the spine, they didn't get better. Some people had horrible nutritional deficiencies. Some had poisons, toxins. It just goes on and on. So we found there's 6 major categories we talk about in our seminars, and how to correct, evaluate, and get rid of the 6 interferences so we can have the 6 steps actually creating wellness and optimal function in the body. And Doug Grant's company is called OHS, Optimal. So have optimal function is literally his goal. And he and I have worked together now. Well, about 20 years ago, we got together for a while. We went our own separate ways and been back together these last 3 or 4 years. And Doug is a nutritionist. He's also a trainer. He's an inventor. He has patents behind his name. And we have very unique sets of nutritionals that we formulate now. Doug is a formulator. I'm a formulator. And we have Mark Harris. Dr. Harris will be on in 1 month from tonight in teaching a class on methylation. And he does methylation classes all over the country. Doug's going to go over that schedule with you in a minute. So please go to optimalhealth.com or brimhall.com and look at the schedules that we have coming up, because Dr. Harris is somewhere a couple of times a month. We have homecoming coming up now too, January 4, 5, and 6. A lot of us get there early on the 3rd because we treat. If you'll give a call to Jason at 480-964-5198, or just go to brimhall.com and give Jason a call to sign up for homecoming, but also to schedule to be treated. Dr. Harris will be here, myself, Dr. Smaldon, Dr. Curtis Turchin. A lot of the speakers are going to be treating that night, including Dr. Smaldon, who's one of the world's best adjusters and tapers. And he's going to go over that. He's going to be teaching that weekend how to adjust and tape and how to evaluate areas. Dr. Turchin is an inventor of lasers, and he has books on lasers. So he's going to be teaching laser therapy for us. Dr. Patrick Porter is going to be there. One of our 6 interferences is emotional stress reduction, and he's developed brain tap. So he's going to have an entire staff there. He has 2 separate classes that just show us how to put the body back into sympathetics, because we're in parasympathetics, because we're in constant drive, because Doug works me too hard and we're just stressed out all the time, right? So we take Optimito and we take other good nutrition, OptiBrain, to balance it out that way. We use brain tap. In fact, I've been trying to do brain tap morning and night with this crazy schedule that we have. And then Clark is going to be there, Clark Tilley, who's helping us out tonight. He has Thrive, and he helps our doctors educate their patients to know how to take the nutrition, why they want the nutrition, and how to stay on it long term. So I don't get too windy here. Just look for the methylation seminars, look for the stem cell seminars. We finished the last one up in Florida this last month, but then Dr. Harris and I will start off in February. We'll probably do the first one here in Phoenix. If you're a doctor doing integrated therapy and would like to host one in your area, give Jason a call at brimhall.com. Look at the phone number there. And if you'd like to help host one of these seminars, methylation seminars, that'd be great too. Then call Doug. So Doug, we're going to turn it over to you. And Clark, I guess they can write questions if they have, and you can bring those up towards the end of the seminar, and Doug can cover them. Fire away, Doug.
All right, sounds good. Sure appreciate it, Dr. John. We're real excited about the seminars coming up, and we hope that doctors, as Dr. John just mentioned, that you really take advantage of those coming up. It's an honor to be in the presence of people like Dr. John at the seminars and their vast knowledge, Dr. Harris, and we really hold to the statement and the belief that you can pretend to care, but you can't pretend to be there. And so we're doing everything we can to be there. These seminars all across the nation, having the large one here in January for the Brimhall Homecoming. and working hard to make it so that we can be there in person and get to meet each of you and let you hear from some of the greatest minds in the industry and ways to be able to improve your practice productivity, to take less time in what you do and actually get more good out of it to help your patients become better and be able to rid themselves of the disease and conditions that are affecting them. So as Dr. John mentioned, the next methylation seminar is next month in Los Angeles, and it's filling up quick. So get a hold of us, and we'd be glad to help you and give you some of the specials and things that make it easy for you to get there and not really take a lot out of your pocketbook. But you can listen to one of the greatest minds in the industry, Dr. Harris, for a few days. It just is an absolutely amazing seminar, and we appreciate you being here tonight. Tonight, we've had a lot of requests from doctors around the nation, actually some from around the world. Some from the Philippines has called in the last couple of weeks and mentioned about this topic tonight and some of the research that we've done and some new research that has come out. And so I wanted to start off with you talking about the main topic, which is a pain relief, disc and joint rebuilding for your patients, and to start off with a study showing what is the main reasons that our patients are coming to the clinics today. And the two out of the top three are based on the subject tonight, on pain from joint deterioration, from the discs losing their elasticity, being able the degeneration in the discs themselves with osteoarthritis, joint disorders, back problems. We know this is a huge issue as one of the main reasons that people are coming to the clinic. So we must have not just the answer as far as the nutrients and the treatments that we give, which we'll focus on here in a minute, but we also have to have the ability to educate the patient, to get in their mind so that they really understand that what you're providing them is going to work, that it creates that effect on the mind-body relationship, to understand and to know that there's research there, to trust in what's going on. Because nowadays, the information through all of the technology and digital medias, through the social medias and everything that's out there today, just blasts so much misinformation that it's caused this mindset to be created in people called the nocebo effect. And we're all familiar with the placebo effect, but the nocebo effect is where if we truly think something's not going to work, it won't work, even though it should. Just like the opposite is with the placebo effect. We know that 20 to 25% of people take a placebo but still receive the same benefits from the people that didn't. But the opposite effect is true too. If we just mentally think that something's not going to work, there's a good percentage, again, up to about 25%, that won't get the effects, even though the nutrients are there, even though everything is present, but the mind. So tonight we're going to be going through some of the information, the research, to help you as clinicians to be able to have in your heart and your mind the power of the research of certain nutrients and things to be able to help your patients, so that you will be able to give that energy as you're talking to your patients to them. Even if we don't speak the right words, they feel that energy. And if they know you believe and you understand, then they will trust you even more. So I'm hoping that we can also do that in the next few minutes tonight. So let's talk about pain. Pain caused by trauma like accidents, by overuse, work, whether it's work or workouts, it doesn't matter, by overuse, day-to-day work, caused by internal stressors, pathogens, disease, autoimmune conditions, viruses, and those things. And also pain caused by misalignment, subluxation, sarcopenia, which is the wasting away of muscle, unbalanced consistency. And what I mean by unbalanced consistency, docs, is that when we have a job and we perform the same job over and over again, we create an unbalanced musculature system that causes strain on the joints and on the tissues. Just yesterday, I was speaking to one of the top rodeo ropers in the entire world. He's a three-time world champion roper with the PIR, and we were talking. We were at a game. Both of our children play in high school sports, and we're sitting there talking. And he says, my non-throwing roping arm is just hurts, and the elbow was sore. And I was touching and working with him with it. And he's, I can't figure it out. That's not even, the one I use the most. So we talked through it and he showed me his technique. And I'm like, how many hours a day are you holding your arm in that position where you're holding the rope and swinging it with the other arm? And, it was 6 to 9 hours a day over year after year. And so we talked about this unbalanced consistency. What's happened is his bicep and his tricep were so tight that it was putting pressure on the joint, not allowing blood flow through the tendons and causing that pain. And there wasn't good nutrients present. So we started stretching him, giving him the nutrients we're going to talk about tonight. And already just a few hours ago, so within 24 hours, he called up and said, hey, I can't believe it. I've had this pain for months and months, and I can already start feeling it's relieving. And I said, well, one is you took the pressure off it because you had unbalanced consistency with your life, and that allowed the nutrients that we put in there to get in and start doing their job. So that's another thing that causes pain. So there's one last thing, is the destruction process due to chronic inflammation. And I'm not talking about acute inflammation. We're talking about chronic inflammation and that destructive capacity that comes along with it. The Center for Disease Control states that 7 out of the top 10 leading causes of mortality are related to inflammation. Again, more of this chronic inflammation that happens because of overuse and all these things, that's constant grind on the system. And we know there's a lot of causes of low-grade inflammation. The constant wearing down of the joints and the disc tissue from movement, from age, and a lot of other factors that are involved in it. But I'm going to jump right into and not keep you all on the phone on this webinar tonight too long. We appreciate you taking your time away from your families, your patients, and we want to make sure this is worthwhile to you. So I'm going to jump right into a few studies. This is actually done by the Chiropractic Association up north. And they were doing the research on pain, on joint tissue, and degenerative disc disease. And they did the study on glucosamine, chondroitin, and MSM. And what was interesting, and the thing I really wanted to point out with this, is that they did a meta-analysis of all the studies that they could find in the literature on these 3 ingredients, the glucosamine, chondroitin, and methylsulfonylmethane, for the treatment of spinal osteoarthritis, degenerative joint disease, degenerative disc disease, and see, what's up with this? What does the research really tell us? And I really was intrigued by this, because if you take a look at it, if you go down here, it says the results. Basically, they showed that one of the results that they could really stand behind, because it was a well done study, had negative results from the supplemented group. But then the other study showed positive, significant positive results. And they went on, and the article was funny because it talked about it. They went through the methods of determining which trials they'd allow in there and which ones they wouldn't, to make sure that they were done properly. They were taking a look at chondroitin sulfate, at the glucosamine sulfate, or the HCl form, and the MSM, and the combinations and the dosages in the peer-reviewed literature. And they all had to have certain criteria with them. They had to be randomized controlled studies. These are studies from 1984 to 2009, so over 25 years. And they went through, and the patients had to have some form of degenerative joint disease or disc disease, spinal osteoarthritis, osteoarthrosis, any of these done that are proven. So they had all this criteria, but yet one of the things that they found out was that it works for some, but it doesn't work for all. So what does that tell us? That tells us is, wait a second, we got mixed signals here. There has to be something involved. When you go to that much work to be able to go through the studies and say, look, if we do our very best and try to make sure the studies are done properly, that everything aligns properly, then we should get consistent results. But they didn't. They didn't. They got great results with some of the studies, and others showed none. So we have to look at, and that's the big question tonight, doctors, is why would some nutrients work sometimes, and why would the same nutrients not work other times? And in this scenario, to rebuild the discs, to help rebuild joint tissue, to be able to supply back the movement, the synovial fluid secretion, and that in the body. So I'm going to give you that answer, and we're going to show you why the answer is so powerful, and what you can do to implement that information in your clinics. So right now, the thing that I'd like you to think about talking to your patients about tomorrow is this, is patients. Have you ever seen studies that show that a vitamin or a nutrient herb's good for you, and then all of a sudden it's not too much longer later that you see them report from the news or whatever that that same nutrient now doesn't benefit the body? Have you ever seen that? Ask your patients that, because I have never met anyone that hasn't said, yes, that's why it's confusing. 1 second vitamin D is good for you, the next second it isn't. I hear glucosamine works, then it doesn't. Why is that, doctor? Well, the reason is because of the form it's in. And let's look at the studies to back up where I'm going to go right now. Here's a study in glucosamine and chondroitin sulfate supplementation to treat disc degeneration, okay, and the case report behind it. And so they looked at this. The conclusion shows that they counteract the symptomatic spinal disc degeneration, especially at an early stage. And they show that the longer they stay on it, the better it is for the patients and helping with the cartilage structure in the body. Now here's another study showing the oral chondroitin sulfate and the progression of knee osteoarthritis, that when given the proper amount, then that's another factor, by the way, that they were able to show a dramatic improvement in the knee joint and the stabilization of the joint space, of the narrowing itself. So we're actually helping that joint narrowing that you see on the x-rays. And the glycosaminoglycans is the chondroprotective factor with the chondroitin sulfate. Now, what I'd like you to do for a second is to focus in on the second study by Shostak that's there. It was low back pain, and it was spinal osteochondrosis. And what they did is they used an injection drug. It's called a chondroprotective drug, an injection of this chondroitin glucosamine type nutrient. It's a chondroitin sulfate. It's a drug called Structum. And what they were able to do in the study is to show that 92%, and there's one right below that that they used in back pain, 92% showed improvement, and it was an excellent response at over 71%. So what we know is that if the nutrients, the glucosamine sulfate, the chondroitin sulfate, get in, like in the case of the injections, that there is a tremendous benefit, that they work. So the problem really comes down to the nutrients not getting into the system. And when we're talking about a glucosamine sulfate, or we're talking about a chondroitin, we're talking about tissue that needs to be broken down. The body has to use its own enzymes to break them down into the gelatinous material, the amino acid structure, so the body can use that to increase the joint space again, to be able to repair the tendons and the cartilage in the body. And when it does, the research is very clear that it works, that we know that it works. There's also a nutrient called MSM, as I mentioned, methyl sulfonyl methane. And there were studies done with it in osteoarthritis pain of the knee. And they were able to show that with OA, the most common form of arthritis, it's the second most common cause of long-term disability in middle-aged and older adults. So not just older adults, middle-aged, second most common cause of disability. So we know this is huge. And MSM, because of its sulfur based in it, actually showed a tremendous benefit. And the results on it show significant decreases in pain and increases in functional movement being on the MSM. Another ingredient that most people aren't familiar with, and the studies are really exciting about this, is one that we're familiar with here in Arizona. I live in Arizona. Dr. Brimhall lives in Arizona. Clark Tilley does. A lot of the great clinicians that will be teaching at the seminar live in Arizona. So we're very familiar with a plant here they call a yucca plant. And the yucca plant, we've known of its benefits for years, just being where we live from, even the old Indian wise tales and the people that are doing their own formulas and remedies that you still run across now and then. And so I started researching this decades ago and found out that the research is really strong on the benefits to this that resemble resveratrol, but it also has some tremendous benefits in the body to work on an anti-inflammatory basis within the joints itself. and it has a factor on the endothelial growth. And so it's a really interesting approach to joint pain and joint repair from a different angle, and something that's also important to take into account and use when you're looking at pain and looking to help repair joints or help with disc material in the body is a yucca plant. So we know the joint spaces can be improved in the body, that they can be improved through certain nutrients, making sure the body's adjusted properly, that it's in proper alignment, making sure the musculature is strong and they're not experiencing sarcopenia. And doctors, if you're not using Muscle RX, please get your patients on Muscle RX. It is a formula that can stop sarcopenia to keep the body strong. So when you do your adjustments, you do your treatments, you're able to get more of an effect and be able to long-term effect because the muscles will support the spinal structure in the body as long as they're strong and they have the muscle to do it. And we have a patent on that formula proving that it can actually do that, to stop sarcopenia and to build muscle in the body, even with minimal exercise. So the joint spaces we know can be improved. The product that we're mainly talking about tonight is Chronic. Chronic being a product I think that we look over. Me and Dr. Brimhall have talked about it before. Like, gosh, we got to make sure we keep getting the nutrients to the joints. We know that we need people on the optimitophorus for the nutrients to the mitochondria. We know we need the adrenal support with opti-adrenal, all these things. And many times, as we start working on these details of the patients, we overlook a little bit of the nutrients themselves for the joints and what the research shows. And optimal chronic, I think, is kind of like the stepchild that's looked over once in a while. And so we want to make sure that we have these nutrients present. And one of the main nutrients, again, is yucca. We talked about glucosamine sulfate and chondroitin sulfate for the research. The nutrient we didn't talk about is manganese. Manganese is one of the few researched nutrients, a specific mineral, as you know, that shows actually helps to regenerate the disc material in the spine. One of the few that there's actually good research on that specific factor with it. And so a formula, it's got to have the glucosamine, both forms of glucosamines, the 2KCl, which is the most expensive form on the market. Very few people use that. The glucosamine HCl, the chondroitin sulfate, the MSM, and the yucca. Those are the main joint and disc nutrients. And we also know that they go a long ways to help with the inflammation factor too in the body. Now, why in the world would a formula that has these ingredients in it, how could we show that it works versus another product like in those studies that has the same ingredients? Maybe they don't have the high level 2KCl glucosamine, but they still have glucosamine and chondroitin and MSM in it. What about the studies that show they didn't work? What is the difference? So just like I started to say, with your patients, it's pretty simple. Patients, have you ever seen the people show the studies or on the news where one ingredient or one vitamin works at one time, then months later they show you that it does the opposite? Well, it is true that those research studies show that, but it's because some of them use the forms of those vitamins or herbs that aren't absorbed well in the body, so they don't get the results in that study. But yet when they use a form that's absorbed well at the cellular level, the results are positive. And that's the case with these ingredients. And I learned from Dr. Brimhall just how hard it is to pre-digest and to break down any type of these collagenous materials like the glandulars or like the glucosamines and the chondroitins and those things. It takes a significantly longer time to break these nutrients down. So if you're asking a gut that's already impaired to take in capsule or tablet form glucosamines and chondroitins and expect the body to break them down and deliver them to the cells before they get through the stomach and the intestines and get passed out the other end, you're basically praying that something's going to happen different than what's happening right now. Because if your system is already under stress because of pain, then you're not going to be digesting as well. So the answer is to ensure that the nutrients in the formula get delivered at the cell level, just like the study I showed earlier where they were injecting these types of nutrients and people were getting the results. Well, we're not saying you should be injecting these nutrients necessarily. There are things to inject. You go to the stem cell seminar and that with Dr. John. But what about every day with your patients and what they take orally? Well, that's where our formulas come into play. the pre-digestion of the nutrients through very specific enzymes, the amylases, the protease 1, 2, peptizymes, all these very, very specific high potency enzymes and trace minerals are in there to pre-digest, to break down ahead of time the glucosamines, the chondroitin, the MSMs, the yucca, so that when your patient takes it, no matter what the digestive system is up to, no matter how acidic, no matter how stressed, you're not asking the body to break these nutrients down. It's being broken down ahead of time. It just gets delivered to the joints and to the tissues. That's why the optimal chronic works versus other formulas with the same ingredients. That's why most of the teams in the NBA and professional athletes use the formula, because they're like, hey, we've tried it before, but what we've used didn't seem to work. But how come this one works? Well, it's because it's pre-digested. It gets to the cell, and they understand that. It's something your patients will understand also. So let's quickly talk about one more thing before we maybe open up for some questions and answers, and see if Dr. John would like to say a few words more. We know that NSAIDs are dangerous. We know that any non-steroidal anti-inflammatory drugs your patients are taking, ibuprofen, the aspirins, especially Tylenols. My gosh, the new research out even on acetaminophen is overwhelming. Just coming to Dr. Harris's methylation seminar to hear about the latest research and that on acetaminophen and its effects on the body and going through the pathways will make it so you never take a Tylenol ever again in your life, and you'll be very fervent in making sure your patients don't either. But we know that NSAIDs like those are dangerous and are deadly. And the process of inflammation is really interesting. Besides the obvious, the pain, the swelling, the redness, the inflammatory response we know involves based off the reticuloendothelial system in the body, and that the vascular walls change and that it creates these symptoms. But the key is that there are mediators produced, prostaglandins that we know of. And we like to tell our patients there's good prostaglandins and bad. We keep it real simple. And the white blood cells help with these. And we know when there's damage, we see the damaged area. And I know as professionals, you understand these slides, that we have the muscle on the outside and we have the damaged tissue. And so we have all of these mediators coming in. And if, in this case, they're supplied with the right nutrients, like the nutrients in the chronic formula or in the acute formula, the proteolytic enzymes, the body starts to come in and heal those tissues, getting rid of the damaged tissue and replacing it with good, healthy tissue in the muscles again. And you will see the improvement as it goes on. And this is just over a 3-week period of time that's supposed to have taken a 9-week period of time. And it was due to the research that was done out of the University of Toronto on the acute formula that helped reduce the inflammation and be able to get the body healed at a much faster rate. And based on the studies, we know that it's because the proteolytic enzymes only block the bad prostaglandins and don't block the good prostaglandins. And the research is really strong on proving that this happened. Here's a research study, the one done at University of Toronto, showing that groups that didn't take any NSAIDs, their swelling, it took a long time for it to come down. But when they took the acute formula and nutrients or NSAIDs, they came down at about the same rate. So we know we can increase swelling at the same rate as NSAIDs. But here's the interesting part. The group that didn't take NSAIDs, they actually healed faster, the one on the left, than the one on the right, the people that did take NSAIDs. Why? Because NSAIDs block both prostaglandins, the good and the bad. So although you get inflammation reduction being on these over-the-counter or prescription NSAIDs, you actually don't heal faster. It takes longer. If you're looking for full healing, you'll be better at taking nothing. But look at the middle. That middle is the acute group, the proteolytic enzymes. So we get the same inflammation reduction as NSAIDs, but we get 3 times faster the healing time, true healing time. And so we reduce inflammation, people are able to get back to work or get back on the court faster, but we also heal faster, so that long term we get the benefit of true healing because of that. So we want to use the proteolytic enzymes, and that's the enzymes that are, again, in the acute formula. Very specific ones, very specific type of proteases to be able to handle any issue in the body. So we know that that's a huge factor. The other factor with it is antioxidants. Doctors, there's very few times that you have a formula that you can say that there's government structure function claims showing that we can make comments on it saying that the formula does something. There is a specific structure function claim, a claim that we can make that the government approved. There's 9 of them, but the one for this talk tonight is we can legally state that the fruit and veggie plus formula creates a healthy inflammatory response in the body. In other words, that we're able to reduce inflammation in the body by taking this formula, and it encourages a healthy inflammatory response, meaning one that heals quickly. So we are excited about being able to do that. So doctors, you could use the fruit and veggie formula and say, hey, there's research showing the government allows us to talk about the inflammatory factors, actually being reduced in the body by taking this formula, because it's a whole body approach. So we need the specific approach by taking the nutrients that are needed on the cellular level, like the glucosamine, the chondroitins, the MSM, and the yucca, to help get in there and repair and work with it. But we also need the full body approach to basically coat the body, coat the insides with this natural anti-inflammatory process to be able to soothe the entire body. And that's really what it is. That's why it has over 35 raw organic fruits and vegetables in it, all proven to reduce the inflammatory response. There's human clinical research, doctors. Tonight was all about research. We have the human clinical, not animal, human clinical studies to show that it helps with Dr. Brimhall's one of his favorite subjects, the mitochondria. We know that we can inhibit mitochondria ROS generation. Again, ROS means free radicals, right? Reactive oxygen species. We know the formula can spike mitochondrial oxygen consumption. This is just in the mitochondria itself that we know we can get a tremendous benefit. Just think about getting that benefit by coating the system with fruit and veggie and then hitting it hard with like Optimitoforce and those types of things. So we get a lot more benefit besides just the inflammatory response, as you'll see in the bottom right-hand side. Inhibit the TNFA induced inflammatory response in the body as to go along with this talk tonight. I couldn't go on without mentioning one thing about exercise, whole body exercise and stretching. And exercise, again, not extra fries, keeping your patients on that. And we have programs to help them too. A lot of your doctors are calling in this week actually and using our Optimal Health Trainer, where we take care of the patient's exercise and nutrition needs and report to you and do whatever you want, or you have our trainer set them up and work with them through the app in live time dynamic, where the trainers and that work with them. And so we recommend you make sure you find a way to teach the exercise part of it too to your patients, whether we help you with it or you do it out of your clinic. So just in conclusion, I know I went over a lot of research studies real quick tonight, but I really wanted to make one point, and Dr. John really is big on this, and I love hearing him talk about the importance of this subject, and that is, it's the form of the nutrients that are critical. It's not just the right nutrients, it's the form of those nutrients. That's what we've got to understand and focus on. And so we do know that the research shows that there are nutrients, specific herbs, nutrients, and minerals proven to help rebuild joint tissue, to help with the space, to help with the disc material in the body. We know that chondroitin, we know that glucosamine in the right forms, we know that yucca, the plant, we know that the trace mineral manganese can help dramatically with these things, but they have to be able to be absorbed. And then we need consistency. We need the patients being consistent with it and then saturating the body with antioxidants. So how do you do it, doctors? You either just recommend the chronic formula to your patients, simply 1 to 2, 3 times a day. And if you would like to incorporate the acute formula, I'd recommend using the joint pack also. The joint pack has 4 of the chronic capsules in it and 2 of the acute, because it does come back to, if you remember on this previous slide, we talked about we need consistency. And the consistency can come many times from making life easy with the packs they can put in their pocket. Okay, patient, I need you to take this 3 times a day. Well, doc, I don't carry my bottle around with me. I've got, I forget. Well, okay, I'm going to give you a joint pack. It has these nutrients in it, has all of the chondroitins, glucosamines, yuccas, MSM. It has the enzymes in it to help with the anti-inflammatory response. And just put them in your pocket. No excuses. You don't have to carry bottles anywhere. So the joint pack's a great way to go also. So doctors, I appreciate your time. Dr. Brimhall, we appreciate you spending your evening with us. I wanted to keep this to about 30 minutes tonight in respect for your time. We do want you to know that we also, for those of you that hung it out to the end here, we're going to offer a 20% off wholesale on the chronic and the fruit and veggie for the next 24 hours if you want to take advantage of that. And just to thank you for being on this call tonight. And I'd like to see if Dr. John, are you on?
I am, of course.
Boy, would you like to cover some of the areas I might have missed, or something you want to add to that this evening about the joints?
It's an interesting situation to be in practice as many years as I have. And people think I'm still in practice because I get calls, texts. My wife thinks like, are you going to answer that text? I said, well, I'm 6 behind. Yeah, I need to answer it right now. And here's, let me just tell you a case history that we came across this week. There was a husband-wife team, great team. They were married over 50 years, and they just had a lovely life. But they found out the calcium that she was taking was depositing in her arteries and not in her bones. So that means she didn't have her vitamin D with K2 in it, did she? She didn't have the organic form of calcium or bone plus calcium like we have. And by doing that, she wound up having to have a couple of surgeries, and the surgeries went wrong. And then she was so stiff in the neck she couldn't move, and she wound up having a fall, and she was dead within 2 months. Again, that doesn't need to happen. We know exactly what builds strong bone. We know bone plus calcium. We know what helps the brain to develop. That's what we have in OptiBrain. We know what increases mitochondria. If you increase mitochondria, every cell in the body functions in mitochondria, and that helps the telomeres to stay longer. I mean, the story goes on, and many of you are seeing patients so much that you don't have time to do the research all day long. But Dr. Harris has the audacity to read the research in 3 languages and remember it and correlate it in his head. He read 15,000 pages of genetics and remembers it all. And that's the testing that he gives you in these methylation seminars. You have a complicated case, well, what are you doing about it? Oh, I'm just cracking and popping and hope they get better. And if they don't, then what? Well, there's many things out there. It doesn't cost very much time to learn the methylation procedure. It doesn't cost very much for the OptiMethyl B that we have, or female plus B. I mean, we have the products, we have the knowledge to help you. And some of the people say, well, why are you talking about stem cell now? Because I'm older. Being 71 years old, I don't want to be 71. I don't care if I live to be 100, but I want to be running about 80 miles an hour right up till I go off a cliff at 90 or 100, whatever it is. I don't want to have to stop and lay down or die because the calcium went in the wrong place. And I have used the stem cell to my own advantage, where I've torn up cartilage and worked 80 hours a day. You think that's hard to do? Well, I've been doing it for a long time because I really enjoy what I do. I mean, this is not a profession to me; it's an obsession. I'm sorry about that, but I think that's what happens with chiropractors and athletic trainers. It just becomes who you are, and you want to help people. So we have found you need to help them structurally, nutritionally, emotionally. I had a call this week, and the lady was texting me like a funny caller. I said, look, you want to talk, let's talk here. But there's 3 members of their family that all have seizures. And the MD said they're not epileptic seizures, so they can't give them phenobarbital or some of the other thing. So they tell them they're just going to have to put up with it. That makes no sense at all to me. I mean, CBD oil is incredible for that. OptiBrain is incredible for that. Craniosacral treatment, adjusting. There's many things. One time, Dr. Brett called me when he'd been in practice, and I was out lecturing full time. He'd probably been in practice for about 6 or 8 years. He said, Dad, I have this guy I haven't been able to help with seizure. I said, listen to yourself. There's practices that have never been able to help me with a seizure. Maybe once in a while, they adjust them, they get better. They don't know why, but they got better. And you've been able to help all these different people who come from all over the world not have seizures. Well, with OptiBrain, CBD oil, craniosacral therapy, percussion, instrument adjusting, we're able to help almost every one of them. What we came to find out with this case, and the MD that was seeing this case thought it was amazing that Brett could adjust them and the seizures would stop, but they wouldn't stay gone. So they did a scan on the brain and found out half of his brain was dead. from so many seizures so intense. So they went and removed half of the brain. There's things we just don't understand can happen. By removing half of the brain, then by balancing the craniosacral mechanism and everything, most of the seizures stop. But now we have a family saying they have 3 children with a seizure. Mom's about to just completely go off the deep end. There aren't easy answers sometimes for complex problems, but there are answers. And that's why we have Dr. Smaldone in adjusting and taping, why we have Dr. Turchin, who's incredible in adjusting, and he's learned how to adjust the body in different ways and look at the body in a different way and use light for healing and repair. We have Vaughn Cook coming, who's the researcher and the PhD that started Zyto. We have a lady coming that uses the ASA or QI5 that does that all day long and learns how to do instrument testing and find out which part of the body is in trouble, what nutrition helps to bring that under control, which areas you should adjust or what acupuncture to use. Dr. Brett has integrated his practice completely. They actually have a nurse in there, a nurse practitioner that can do injections, and so they help people with anything, is what Dr. Mark teaches. We can use ozone, we can use prolozone, you can use stem cells, you can do quantum physics. Dr. Harris is teaching quantum physics treatment with a bi-sugar dextrose, a 2-sugar molecule that triggers a quantum reaction in the body. And I'm seeing reverse migraines after 30 years in 1 or 2 treatments. Chronic leg pain for 30 years go away after 1 treatment. And it's a special nervous system we haven't known much about. So the fact he can read in multiple languages and he correlates all in his head, he's developed a whole program for treating these areas. Now, we can't show you all this at Homecoming. We're going to show you a lot. So with Dr. Porter and Dr. Turchin, Dr. Brett, with Doug, with Clark being there, we're going to help you be able to evaluate your patients, get results you haven't got before. In fact, we call our work mentoring and miracles. If you're not having to stop at the end of the day and discuss the miracles you've seen in your practice, you're not doing what we teach. That happens every day in our office. We went to a wedding, and one of the family members here, and my wife Susie, we've just been married a little under a year now, was there for the first time, being around all my family and all the people that came from up north where I practiced in Holbrook before I came down here. And then people were down here came up at me at the wedding and they say, you know, you saved my life. You saved my son's life. You started my son over. He no longer has diabetes. She heard this all night long. And she said, wow, who are you really? And well, who I am is somebody who's possessed and obsessed with helping people. That's who Doug is. That's who Clark is. That's who Mark is. That's who all of us that work as a team to bring health and wellness to the world. So share it with us. I'm not going to be around forever. I'd like to leave our work forever, though, so we understand and can evaluate the 6 steps of wellness. And we can treat it properly with structure and nutrition and stress reduction and detoxification. We have something for everything to increase optimization. Oh, optimal, that's a good word. We should call this optimal health systems. Let's do that. We look forward to seeing you at Homecoming. It's early in the year. Come and take a little vacation in Arizona. It's going to be cold where you guys are anyway. And in Arizona, we're almost guaranteeing good weather here at the first part of January. Nobody likes to come in during January anyway, the first part. So you might as well be here having fun, bring your family for a good vacation, and learn more than you could imagine in the days that you're going to be here. Good night. God bless you all. And thanks, Doug and Clark, for being here with us. We look forward to seeing you guys in 2 weeks when we have Zyto on with Vaughn Cook. 2 weeks after that, Dr. Mark Harris. Good night and God bless.
Thank you. Good night.